Hello, my name is Janice and I'm the nurse here at Pacific Center for Plastic Surgery. Today I'm going to be talking to you about your post-operative instructions for gynecomastia. The thing we want to talk about first is your activity level. You want to keep yourself resting for the first 12 hours after your surgery and not do any heavy lifting, bending, or exercise for the first 1 to 2 weeks following your procedure. You can gradually increase your activity level from day 1 up to the 2 weeks when you can go back to your normal activity level. Next, we are going to talk about your position. You're going to want to sleep elevated on at least 2 to 3 pillows that will be supporting both your head, neck, and your back. You will be sleeping like this for the first 1 to 2 weeks following your procedure. You will also want to be sure to provide yourself with some old towels that you place underneath the areas where you've had the liposuction, because you may leak some blood-tinged fluid. Let's talk about ice packs. Ice packs are suggested if you have excessive swelling. This can also help with just the comfort of your recovery period. Be sure that you do not place the ice packs directly on the skin, that you actually place a barrier in between your skin and the ice pack. You may leave them on for 20 minutes and then remove them for 20 minutes at a time. It's recommended to use the ice packs for the first 48 to 72 hours. Next, we will be talking about wound care. Each of your incisions will have a layer of tape on them. Please leave that tape on until your first post-operative visit. If the tapes happen to fall off, you may leave them off, but we would like you to clean the incisions with half and half hydrogen peroxide and water mixture. You then want to place a layer of a bacitracin ointment on those areas. You may shower 3 days after your procedure. If you still have the tapes on at that time and you have not had your first post-operative visit, please leave them in place and just dry them with a light, cool setting on your hairdryer. You must wear your garment for the first 4 to 6 weeks following your procedure, or unless advised differently by your physician. The only times that you will be allowed to remove your garment are for showering, or if you take it off to launder it. Your driving needs to be restricted until you are off all pain medication. It is normal to have swelling and bruising in the post-operative time frame. You may also notice a little bit of bleeding, which is also considered normal. The things to be sure that you do not come in contact with are anything that may lead to an infection. Signs of infection include excessive swelling, excessive redness, or a fever over 100 degrees. Please call the office if you notice any of these signs or symptoms, or if your pain is not relieved by the medication that has been prescribed.